going to be on women lifestyle and women health to begin with. If you can see here, I've just tried to put this quote to you that that the world has seen that through this pandemic, women leaders have been very successful at managing and controlling the pandemic in their countries, and that includes New Zealand, Germany, Denmark, Iceland, and more. And we're seeing that as these women are empowering their countries, there are also women who are empowering healthcare. And so many women in medicine today are really trying to transform the healthcare. And also, as me and today's speaker, Dr. Girija Wagh, we believe that transforming or empowering women will actually create a new paradigm in health, because we all know that our health begins from our mother's womb. Our nutrition begins from our mother's womb. So that is the reason why we decided to have a web series, and we're trying to be here on every Wednesday. W for Wednesday and W for Women's Health is what we call it. And without wasting any much time, I will actually quickly give you the introduction of Truwellth. Truwellth is an integrative healthcare initiative guiding patients and healthy individuals to overcome their health concerns and manage self-health to reach the ultimate goal of holistic health and happiness. Truwellth aims to help you separate science from hype by sharing authentic knowledge and wisdom from healthcare and nutrition stalwarts so you can make the right health and nutrition choices. It also desires to unleash the therapeutic role and potential of nutrition in curing and preventing diseases of today, which even modern medicine is unable to partly or completely take care of. Truwellth's ultimate goal is to provide integrative and personalized health and nutrition advice to achieve health and happiness. Truwellth is actually very fortunate to be able to do this with Dr. Girija Wagh, with her Girija Hospital and Fertility Center. And we are very proud that we are running a integrative approach towards women's health. And we will be talking about one of the important conditions, that is PCOD and PCOS today. But a quick note before we get on to it, this live program is organized to get more information and guidance to keep health, nutrition, and fitness during lockdown. The recommendations made by the speaker and other participants cannot be treated as consultation. For personalized consultation, you can reach our consultants on 9820048369 or visit our website www.truwellth.in. To ask questions, also you could call on to the same number 9820048369 or type in your questions on the Facebook Live page comment box. You can feel free to ask us as many questions and concerns that you have, and we will try to do more than justice. However, please note that this program is not intended to provide any information on COVID and related treatment. You should approach hospitals and doctors assigned by authorities to get authentic information on COVID-19. So today's speaker is, according to me, elite celebrity who inspires me and has been inspiring many women. She has treated or has touched in her life, and a very and her long experience of almost 3 decades into gynecology. So Dr. Girija Wagh is a gynecologist and seasoned professional with specialization in high-risk obstetrics, gynecology, endoscopy, and fertility. And like I said, she has almost 3 decades of experience in the same. She's done an MBBS, of course, an MD obstetrics and gynecology from the PJ Medical College and Sassoon General Hospital, Pune. She's done her diploma in advanced gynecology endoscopy from Germany in 2008. She is also fellow of Indian College of Obstetrics and Gynecology. She's fellow of Indian College of Surgeons. She's a consultant currently practicing at Cloud9 Apollo Hospitals and HOD at the Bharti Hospital, Pune. And she runs her own nursing home, Girija Hospital and Infertility Center in Pune. Her area of specialty includes normal and high-risk obstetrics and gynecology, IVF, fertility treatment, diet control, which she keenly believes in, PCOS, PCOD, procedures of fertility promoting laparoscopy and hysteroscopy surgeries. She's chairman of the Medical Disorders Committee, FOXY, 2013 to 2016. She was director of Galaxy Laparoscopy Institute, 2006 to 2011. She has been member of the OG's Steering Committee and International Organization. She has been a member of the advisory committee to the Union Health Minister. Also, Dr. Garg is a staunch feminist and believes in empowering women through health. And that's the least and the most big reason for her actually to be here with us to discuss women issues, beginning with, and I'm going to try to bring her here, right here. Hi, Girija madam, how are you doing? Before we actually start the session, we would love to actually have you tell us more about what you think, what's going on today, and then actually going on to the subject. Ma'am, you'll have to unmute yourself. We can't hear you.
Okay, can you hear me now?
Yes, absolutely. So we welcome you. We welcome you here, and we definitely want to hear from you in general, and then of course what you're going to cover on an important topic today as we start the series on women health.
Yes, thank you so much for that wonderful introduction. And thank you for creating this platform, because this has been always my dream to reach out to women, do some sort of an education to empower them. And currently, as we are by the policy coherence in way, I think a much bigger way in the COVID, we need to reach out to more and more people. So as we had decided with our entire itinerary, yeah. Am I there?
Yes, you're absolutely here.
Yeah. And are you able to see my screen?
Yes, very clear enough.
And you're able to see my PowerPoint presentation?
Yes, absolutely. Yeah. You can.
So, yeah. So we move on to the polycystic ovarian syndrome as we talk of it, and there's always a confusion, you know, we want to know whether it's a PCOS or a PCOD.
Yeah.
Now, PCOD was something which was decided in the past when people used to call it as polycystic ovarian disease. But then over a period of time, it was understood that that D has to be taken off and it has to mean a disorder. So it was called as polycystic ovarian disorder. But now we have understood that it is not a disorder. Also, it's a syndrome. By syndrome, it is associated with disorders, but syndrome because it has a lot of phenotypes, a lot of various, implications, and a lot of variety of things within the disease conglomerate. So if you look at this particular news bulletin, which had come just a few months back in the Hindu, and it was saying that if you find that 1 in 5 Indian women suffer from PCOS, and there is a peak in the hormonal issues, draws attention to poor lifestyle habits, and the doctors say that 80% of patients of PCOS are obese. And that is the reason why, Rajeshri, I find it extremely nice to be associated with you, because without you and your insights into this disease process, we are just not going to be able to reach out to our patients with proper care. Right. So if you look at the increasing number of women in the reproductive age who are suffering from this syndrome, it is important that there is more awareness about this condition, pan country and pan the globe, and because it's a lifetime disorder, and it can be simply controlled by a proper diet and a lifestyle. And that is the reason why we need to reach out to more and more people with such kind of sessions that we are having here. Now, if you look at PCOS, you can see in this particular sort of a poster is genetic, hormonal, metabolic, and reproductive disorder. So you can understand that there's so many things associated with it. Genetic means you have predisposing factors. It influences your hormones and especially the reproductive hormones in the women. And it has metabolic repercussions to the woman, giving rise to problems getting babies and therefore infertility. And it can also lead to serious conditions, including severe anxiety, depression, because the hormones are irregular. So these kind of things would happen. Obesity, endometrial cancer. What is that endometrial cancer? We'll be seeing shortly. Now, if you look at this picture, which has come on the slide, you can see this is a picture of the womb. And inside the womb, there's a cavity, and that cavity is called as endometrium. And that endometrium gets the cells which are lining the endometrium, we know, are shed out at the time of menstruation every time. These cells get abnormally sort of stimulated and programmed by irregular hormones which are happening because of this abnormal disorder or a syndrome, giving rise to a possibility of women developing endometrial cancer, metabolic diseases like type 2 diabetes, and heart disorders or cardiovascular disorders. So it's estimated that about 10% of women of the reproductive age group would be affected. 50% of the times it may go undiagnosed, and that is very important. 50% of women who will develop type 2 diabetes or pre-diabetes before the age of 40 are having PCOD. And it is definitely a disorder which is going to cause a lot of expenditure to the women and to the country. And therefore, we have to be extremely aware of it, because the end point, many a times, these women would have very early age endometrial cancers. And therefore, it is our duty, and we are duty bound to protect to women against the malady of this disorder. So you can see here, I don't know what happened.
Oh, we can see the slide.
Yeah. And if it's not monitored in time, the condition can have serious health impacts. You can see it, Rajeshri?
Yes, yes.
So now there's something more interesting that I wanted to bring forth here, Rajeshri, that if you look at 40% of the chance, if this female child has PCOD and she later on decides to become a mother, 40% of the times her offspring is going to be programmed to become a PCOS. So our responsibility is not only for now for this index patient who comes to us, but for the transgenerational transfer of the future generations is also important, because if you can see in this picture here, the maternal ovary as well as the fetal ovary would both get affected by these abnormal influences of the hormones and the related consequences that are there. And you can see that there have been studies conducted in this Swedish and Chilean women, and there's a large amount of data that you can look at. And it was found that women who had menstrual disturbances, hyperandrogenism, that is excess of androgenic hormones giving rise to estrogen, polycystic ovaries, and associated features like obesity, infertility, their daughters had an increased chance of developing the same disorders. And they have also done studies on mice models where they found that there are alterations in the gene packaging of such a kind that the fetal ovaries are also programmed. So currently you have PCOD, your daughter will have a PCOD, and her daughter's daughter is also programmed to have a PCOD. And therefore, this is a responsibility that all of us have to take for our future generations. Now, women with PCOS are at a high risk of developing diabetes, blood pressure, and other health complications, and usually have a very high body mass index. And the more peripheral fat one has, more is the hormonal imbalance. And you can see here, there's a very simple formula. What is what you call as do it yourself finding, wherein you measure your height and your body mass, your weight, and use this formula to measure your body mass. And body mass index for any of us at in our age has to be 25 or less. If it is found to be even 27 or 28 in the Indian context, this can cause alarming abnormalities in their endocrinal and metabolic parameters. And as you can see here, 24 to 30 also is taken as an overweight women. So many times women would say, mote pregnant nahi hote kya? Of course, they can, but then there are complications which are associated.
Yeah.
Let's quickly understand as to what is this that I'm talking about. Yeah. Now, in this corner, you can see that this is the female body, and below the pelvis is situated reproductive system, the uterus, and by its side are these ovaries. So this all havoc is conducted by these small little organs, which are 1 by 2 into 3 centimeters only by their volume. Just imagine, their volume in a normal state is not more than 8 centimeter cube, 8 millimeter cube. And these ovaries get abnormally stimulated and cause. Now in the picture, ovary is studded with various kind of follicles, which is egg. At a typical time, a regular menstruating woman would get released at the time of ovulation. That is what happens in a typical menstruation. What happens in a PCOD is these eggs which are present in the ovary do not get released. They just get stuck in the ovary and they cause the ovary to swell up, studded with this unreleased eggs, giving it appearance typical polycystic ovary. So polycystic ovary is actually a name derived from the architectural change that occurs in the ovary because of these eggs which are stuck in the ovary and not undergoing any release. And all these eggs which are stuck in the ovary are immature eggs. You can see in this picture here that you have a normal ovary, and you can see the cut section also here of the normal ovary where you have various stages of the egg formation and release. While if you look at the cut section of the polycystic ovary, it is an ovary which is swollen up, increased in size, studded with immature follicles which are cystic in appearance, and therefore poly means many, cis means cystic, and that is the typical polycystic appearance. So how do we determine? So it's actually a hormonal disorder, and we know that a common diagnosis in women presenting with infertility, usually when patients come to us with pregnancy, they're not able to have children, or they are having repeated miscarriages. And if we go down and investigate, we find that they have PCOS. And you have to understand that it is not a disease and it is a lifelong condition. So the symptoms would be typically irregular. What are the reasons why patients would come to us? They would say that, doc, I'm having irregular cycles and delayed periods, or sometimes no periods because of lack of ovulation. Now imagine if a woman is sexually active or married, it's a challenge in front of us. Is she pregnant, or is she having a no menstruation, or amenorrhea as the condition is called as, because of absence of menstruation because of PCOS. She will have excess facial and body hair. She may have a lot of acne on her face, and she may have thinning of her scalp hair, and generally a sort of a water retention kind of an attitude. Now, so many times in our country, we also have a challenge where we have women who are very thin and still they would have PCOS. So they are another challenge, because if a woman is fat, then we can at least tell her to lose weight. But in a child who is thin, it is definitely challenging. And when we do a sonographic evaluation on a typical day, it's always ideal to examine the ovaries on the second to the fifth day of the menstrual cycle. You will find that the ovary is studded with multiple cysts, and that would probably make us suspect a polycystic diagnosis. Now, there are a few questions that I have posed here for our audience, and they are supposed to tell us in the chat box if they want answers to these questions. Because if they want so, then we will be arranging to answer them, because that will be taking them to a higher level of information. So do you want to know about irregular cycles? obesity, future health, or infertility in details? If the answer is yes, please tell us which ones you want to know so that our subsequent sessions, we will typically have concentrated or focused discussion on those particular issues so that we are better able to utilize our time and understanding. Now, the causes of this particular syndrome are basically, as I mentioned, obesity, and this is usually due to unhealthy diet and lack of physical exercise. There's typically a family history of women or mother or sister who has PCOS. And typically in the Indian phenotype, we find that the fathers are diabetics. And the reason why I find this in my history is probably because the mother is never screened. It's usually the father who receives all the attention and he's screened and we know that he's a diabetic or he's an hypertensive. And therefore that will be a typical family history of dad being a diabetic. And then there would be various other signs of insulin resistance, which is called as type 2 diabetes, which is usually acquired because of abnormal lifestyles. Now, I want you to pay a little attention to this pictorial depiction of the causes of PCOS, because you will find that if you look at the rooted in the hormonal imbalances, excessive androgens, that is male-like hormones, which would give you mustaches, beard, and hair on the body, or some sort of a change in the physical architecture. There is excess insulin, which triggers the ovaries to make more and more androgens. And there are other causes which are genetic, where women whose relatives had PCOS are more likely to have it. Inflammation, and this is very important, that is certain internal kind of a swelling, let us say, which can give rise to increased androgen, which gives rise to formation of so much of noxious things inside your body that nothing functions well. And usually the lifestyle factors are poor diet, smoking, insulin resistance, which are all linked to PCOS. Now, if you look at this picture here, on the left side, it is showing a normal menstrual cycle. And you would find that the estrogen hormone, which is a typical woman's hormone, is rising in a very typical pattern throughout the menstrual cycle. And then looking at the right time during the cycle, you can see that this is the cycle between the actual 28 days of the cycle duration. And you can find that there is a wonderful kind of an orchestration which has been created by the nature, wherein the estrogen will glow in a particular waveform, and then testosterone will be there sitting quietly below and acting and doing its function as much it has to do. While in a PCOS, you'll find that this estrogen, the woman's hormone, is suppressed. So naturally, it is not working on any of her feminine body functions. It is even, from thinking to your skin turgor, to your water retention, to your ovulation, to your menstruation, everything seems to be get affected. Also, their bone health, their cardiac health, everything can get affected. And you can see that the male hormone, that is the testosterone, is constantly ruling the roost. Now, just imagine that you have such kind of a phenotype where you are actually a woman, but there is a constant kind of a male hormone coming into your body. And that is how a typical physical and a metabolic presentation would be there. And the doctor has to behave like a Sherlock Holmes, a true detective, to find out where things are really going wrong. And this is a little complex picture I've just put in here. You don't have to understand this. That in a normal menstrual cycle, the various hormones go this way, while the PCOS would go in a typically different fashion. The reason why I put in this picture here is to make you understand that your clinician is trying to do your tests. Sometimes the clinician would tell that please do hormonal tests, please do metabolic tests, because he or she wants to establish what is your actual problem based on your age group. So if you're a teenager, there will be different calculations. If you are a peri-adolescent, there'll be a different things. If you are now in your adulthood, your interpretations would be different. And if you are a woman who is now wanting to get pregnant, then your calculations and your investigations would be different. So we do not use the same McDonald's burger, doesn't fit for everybody. We have to keep on changing the filling and the investigation, and accordingly the doctor thinks, and therefore this test may be advised to you. So the next question, and the question second, which is going to help us to make our sessions a little more meaningful for you, would be, do you want to know the tests and little more about them? If the answer is yes, you please let us know in our chat box, as Rajeshri has told you, so that we can have one focused understanding about the investigations, because I feel sometimes if the patients understand this, then they are able to understand why the doctor is prescribing certain medicines and trying to help them. Now, one of the most commonest factors which have been identified to be responsible for this haywire setting of all the metabolism and the hormones in the woman's stress, the different kind of response in the other. Stress is actually your response to whatever is happening around you. It is raining heavily currently in Pune, but I have decided to spend my time with you all and Rajeshri sitting on my deck and enjoy the beautiful weather. So this is how I am responding to this particular occurrence. But there will be somebody who is responding, kitna katkat hai, main ye nahi kar sakti, main wo nahi kar sakti, ye nahi kar sakti. So you can understand the occurrence is only the rains, but the response of everybody can be different. And that is something that every PCOS suffering person has to self-audit and ask, am I stressed out about something, and what is it that is causing me stress? Because stress would affect your nervous system, the brain, the thinking pattern, and everything that is being controlled in your body, physically as well as psychologically. Your muscle mass, your musculoskeletal function will get affected because of stress. Your breathing pattern and hyperventilation, you keep on always breathing superficially because you're constantly stressed. That is going to cause you ventilation and oxygenation problems. Then there can be cardiovascular system problems where your heart rate will be always high. Yesterday, my sister decided to measure my cardiac, heart rate. And she said, doctor, your heart rate is just measuring 64, 65. इतने ठंडे कैसे हो आप? मतलब मैं सीख गई हूँ ठंडा रह के मेरे PCOD patients के साथ. There is no point in unnecessarily getting hyper. So it is going to affect your cardiovascular system. It is going to affect your gastrointestinal system. Many women suffer from acidity, dyspepsia. They are not able to digest food. They are constantly taking something to stimulate their, mood, bones, everything. And this is also going to affect your gastrointestinal system. You'll not be able to digest micronutrients, and all this can cause problems. And all the brunt in the woman is taken by the endocrinological system. Typically, women would have hypothyroidism. They would have irregular cycles, and then the female reproductive system gets affected. Typically, there would be polycystic ovarian disease, there could be endometriosis, fibroids, and all these things are just related to one factor, and that is stress. So before you even consult your doctor, ask yourself a question. Am I stressed out? And find out why, and maybe your doctor will be able to help you. So the next question on this particular introductory session that we're having today is, do you want to learn from us about stress management? And between Rajeshri and me, definitely going to help you with even this. There can be a lot of ways in which we can approach stress, not only through certain practices, mind modulation, but also through physical exercises and even through dietary changes. And Rajeshri is an expert in that, and we learn about that too. Is not that we identify it started with a hen or an egg. Disorder शुरू हो गया, फिर problem शुरू हो गया, problem था इसलिए eating disorder हो गया. And then sometimes, typically when I've interviewed my PCOD patients, I find that most of them have some very terrible dietary practices. They take a lot of junk food. They are constantly dependent on food. They're all the time hungry. And therefore, probably, you're trying to find some appeasement, some sort of respite probably through food. So that is also something that we need to understand. Yes, it has to be blamed on your hormones, but finally, our body has to be in our own control. And that is something that we have to understand. Because let's look at simple noxious elements like lifestyle, smoking, obesity, alcohol, lack of UV light and fresh air, All these give rise to release of free oxygen radicals, which are known to initiate inflammatory processes and affect all your wonderful metabolisms in the body. God has given you such a wonderful body, and the entire system is so beautifully regulated. But if we do not take care of it, it gets destroyed, and unnecessarily we have diseases like endometriosis, PCOS. And this is because there is the immune system gets affected, and you cannot protect yourself against this increased oxidative stress, which can give rise to problems not only in women, but also in men. There can be excessive aging. Sometimes I have a very young 27, 28-year-old woman and a man walking in my OPD, and they actually look like 35, 40-year-old couple because there's so much of stress. There is improper lifestyle. And this gives rise to apoptosis, if you're reading the word here, is tissue destruction. Can you imagine? Sperms and eggs are creations of the Almighty, which are meant for the continuation of the race. And they're so well protected that they'll never get affected by anything. But today we are finding in the environmental busters and in the abnormal lifestyle with the oxidative stress, these are also getting challenged. It's really a high time that we started looking at what we really are doing. And all this can lead to painful periods, heavy periods, diabetes during pregnancy, heart disease, high blood pressure, high cholesterol, which we typically call as dyslipidemia, stroke. Many women will have NAFLD, that is swollen liver. Without even drinking alcohol, your liver is swollen. Cancer of the uterus, depression, anxiety. Constantly they're so unsure about themselves. They have a loss of self-esteem. Their body image is affected. And so many issues we unnecessarily have to face. So coming quickly to the last two slides on treatment is, what does the doctor do to you? First and foremost, believe me, friends, PCOS, I believe strongly, is both preventable as well as treatable. Whatever maybe the searches say, I love to spend time with my patients and make them understand, take them through every little aspect of screening, diagnosing their condition, categorizing their phenotype, and tell actually what kind of a problem that they have, treat them specifically, and definitely work towards prevention, not only in the future consequences for that particular patient, her children who are yet to be born, and further her grandchildren who are going to be born. So we have to understand that this is going to be your issue. So it's very important that you see your gynecologist if you observe any symptoms, especially irregular or delayed periods. Just don't blame them on stress or anything. Go and find out. You may be having PCOD, you may be having underlying disorders which require attention and to be checked. Because if you look at the simple things that can be changed, and which Rajeshri is going to tell us wonderfully, that just by going a simple thing ahead, by changing your lifestyle, especially nutritional changes, you'll be able to modify your insulin resistance, your weakened immune system, the accumulation of toxins, and prevent the genetic legacy of this disorder being transferred. So one more question here for our future sessions is, do you want to know about treatment details? And we can take you through a session wherein we will talk to you about the details of all the pharmacotherapy and the modifications that we are doing. So with this, I end my small presentation with a sort of a promise, and a promise which I want from all of you. Let us all come together and eradicate PCOS. I want every woman in this country to be healthy, to be smiling, to be happy, and to be beautiful. And beauty always comes through a lot of inner peace. And that is where we have to reach out to. Off to you, Rajeshri. Thank you so much for the patient hearing.
So that's a really encouraging statement when you say, our country has been able to do get polio-free India. So a PCOD-free India is a movement actually you've initiated, and we would love to be a part of. This is just the beginning, I guess, with this series that we are starting. But yes, of course, I am with you in the promise, and I'm sure a lot of our viewers are also in the promise to make the change in our generation itself, so that it doesn't pass on to the next and the next and the next generations. Unfortunately, a lot of us have been experiencing this issue, and like you rightly pointed out, it is food that really can make a huge difference in terms of not only making the change, but also what we're eating today is not what we ate, our parents ate, or our grandparents ate. So there are a lot of hormones, there are a lot of a lot of mutations that we actually see in our hybrid foods today, and I think that is really also a big reason that nutrition becomes very, very important. So absolutely, like you said, my first slide itself says that nutrition and dietary habits, and I call it habits, can play an important role in the prevention and treatment, and the lifestyle modifications are the most important therapeutic strategies in patients. So if anyone asks, do I have a magic wand? Because I know there are a couple of questions asking that what foods can help, and what supplements can help. Yes, foods and supplements can help, but more than that, I think it is the lifestyle modification that really makes the difference. And of course, the integrative and personalized approach, which can make a difference. Here, I have specced it out that these are the foods really, and these are the supplements. If you can see, we have omega-3, vitamin D, inositols, magnesium, zinc, berberine, melatonin, probiotics, vitamin B12, and NAD, that is N-acetylcysteine. All of this sort of, if you see, uh, this diagram is very interesting because a lot of them have to be taken together. One single ingredient in isolation will not help. We need to have a balance and combination of both foods and nutrients in our foods. And I am going to, just as ma'am said, this is a session where we are sort of going to go preliminary with our approaches. So I am actually going to just go with an overview of what can be the nutritional changes that can be done by us. And then, of course, we'll go polling, and then, as she said, we will give more specific instructions when it comes to foods as well. I will plan to do a separate session with Dr. Garg, and then we will actually, so it will sort of make a lot of difference. See, specific goals, as some of them, Madam even mentioned, of the nutrition and diet therapy must be to improve insulin resistance, metabolic and reproductive functions. And through the design of course, low calorie diet to achieve a weight loss or maintain a healthy weight, I would say. Because at times we see a lot of changes if there is unwanted weight loss as well. So we need to maintain a healthy weight. We need to maintain a positive weight, that is muscles and less fat, and increase intake of proteins and fiber. Of course, we keep talking about this. A lot has been there in the public domain, but how many of us are really practicing this? And which is why I have a diagram here where this lens sort of shows what are the nutrition facts of what we're eating. It doesn't matter kiti samcha and kiti vati we ate, but that matters. But the point is we really need to first understand what are the type of calories and what are the type of foods that are or ingredients that are there in these foods, and adequate consumption of vegetables and fruits. And again, which vegetables and fruits is also important to get ample fiber and antioxidants, because vegetables can give good fiber and fruits can of course give loads of antioxidants. The attention to supplementation of vitamin D, chromium and omega-3 needs to be kept. These are very critical supplementation in PCOS, PCOD, and the enzyme-rich foods or supplements help complete digestion. So they are very critical again, because what we observe, acne is a common issue, and we have seen a lot of changes if enzyme-rich foods or enzyme supplementations are consumed by such women. We need to limit the intake of simple sugars, of course, and that also includes high fructose syrup. That is, higher concentrations of sugary syrups, fructose syrups is again not very advisable. Corn syrups, there you have to read the labels of your products that you're consuming. Refined carbohydrates, of course, the what has been said, and food with high glycemic index. This needs to be avoided. What are foods with high glycemic index? You will be shocked to know that probably samosa has a better glycemic index than a bowl of khichdi of a sabudana khichdi or a vada you're eating. So, that differentiation also needs to be understood well, what you're exactly eating. Then the reduction of saturated and trans fatty acids. Like we said out here, PCOS sort of affects the metabolism as well, our gynecological health. So these are the foods that need to be avoided: gluten, dairy, alcohol, and in PCOS, avoid coffee, seed oil, and in both we need to avoid sugar, soy. Soy, again, I would say is a very confusing input. None of these typical paper ones sort of work, and I'll go over to that in a few seconds. But avoiding processed and junk foods, that's very important. Minimum of 2 liters of water. Eat mindfully, again very important, so that our binge can lower really. Eat more number of times and small portions. This also helps in gaining better nutrients, and not binging. So you eat multiple number of times and you don't feel super hungry. Plan your meals well. Like I said, plan your day to meet your protein and fruit needs. Before noon is what I always do with most of the patients I am working with. So what happens is, even if your day goes rush after that at work, you're done with your essential important ingredients in the morning. And then dinner should be light, of course. These are a few suggestions. So if you see, for you to quick and easy understand this, is cover, if this is a plate, a PCOS plate should look like, is cover half of your plate with low starch veggies, and there are quite a few number of examples there. Cook or top veggies with healthy fats again. Then add a handful of carbohydrate dense whole foods on 1/4 of your plate, and fourthly, protein dense foods on 1/4 of your plate, which you can see here. So those are the proteins that are here. So all these are the kind of quick steps that we can follow, but do quick steps really work? I'm not sure. I'll share those experiences with you soon. So PCOS, here I've laid out what could be PCOS friendly carbs, and what are slow carbs. So oat, you can see millets. These kind of vegetables are also a good slow carb, so they slowly get absorbed in your body, digested and absorbed in the body, and at the same time fast carbs, you can see French fries, pasta, bread. All of these are something we should sort of keep away from. The 8 supplements which I showed you earlier as well include several of them: omegas, iron, inositols, and we both, ma'am and we, actually love to integrate all this. So I would sort of lastly stress on what madam said, and that is the inflammation. So inflammation is something which, momentary inflammation is good. When you get hurt or you're fractured, at those times getting an inflammation to get over those kind of problems is just inflammation. But a chronic inflammation, and which is observed very, very much these days, along with the stress, which intrinsically is oxidative stress, are the most dangerous elements. And what most effectively works, and we are actually doing a study, both of us, is not just knowing these charts. They're always there everywhere, but how much of it are we following, and how much of it are we integratively working with our own doctor and the nutrition expert together? That is extremely helpful. And here are the quick steps which we normally do, and I'm going to end with my presentation with that. Is we first do anthropometric steps, the tests that are required. we study the biochemistry, that is the blood sugars, hormones, insulin, lipids, all of those are tested. And this could mean that, too much of testing is done, but these are bare minimum, not bare minimum tests that we need to do so that long-termly the issue can be taken care of. And then we do a nutritional assessment in terms of what you eat. Nutrition doesn't mean dieting. Nutrition and diet both together is important. How much of nutrients are getting absorbed, that is again very critical to access over a period that we work with you. So it's normally a 3 to 6 months integrative and personalized nutrition plan. And when I mean integration, it is integrated with the treatment that you're taking from your doctor and the nutrition plan. So these are very important critical points, and supplements are there. If required, we give the supplements. And then lifestyle counseling is what I feel is the most important aspect here, because we've seen so many patients of both of us have seen so many patients. Someone is working in corporate, someone is staying at home, and someone is in the college. All of them are, the major issue that we see is the right understanding of the topic, the right planning, what they should be consuming, and what sort of a lifestyle they should be following, along with good monitoring. These are the most important things, and making them understand what is right for them, identifying what is right for them. All these are most important things, I think. And then we give guidance on grocery shopping to reading labels. All these are important aspects so that you yourself, after those 3 to 6 months, learn how to manage your own disease. And that's how we can be successful in eradicating PCOD, is what I think. And of course, the exercise protocols are extremely important. Our country's fitness regimen is something which we absolutely ignore, and a right exercise plan is extremely important along with it. So, following up with you, sending you nutrition updates, and phone counseling is really what is most important, I think. And that's where I think both of us together are working on this mission. And we are going to take it, though this could be a beginning. We're going to take it up in a very aggressive, assertive, big way, so that we can get success with a lot of women. That's from me, ma'am. I hope that's aligning with your thinking process. And
absolutely, Rajeshri.
Yeah. So we do of course have a few questions which have come from some of the patients on Facebook, as well as some that have come in my WhatsApp. And of course, you did explain what's the difference between PCOS and PCOD. That was one of the questions. The other questions that are here is, there's one question a lady is asking. She says, I have irregular periods. I have put on weight of late. So, while I'm not able to get my periods, my thyroid hormone levels are though normal. So could I be having a PCOD? Because I think she is struggling because the diagnosis is not happening properly, and that's a gray area. What would you suggest?
So first and foremost is having said that she has this kind of a water retention of increased weight and irregular cycles. It is not only the typical PCOD kind of a phenotype. I would like to really stress on finding out more additional things in her apart from her thyroid levels, and that is finding out any signs of insulin resistance. Many times, by looking at a sugar profile, by giving her sugar challenges, by looking at the glycosylated hemoglobin and her triglyceride levels, we will be able to analyze whether she has a metabolic derangement. And many times, the reason for this metabolic derangement also gets overt by understanding whether she has additional B12 vitamin D deficiencies. Now, while most of these deficiencies we cannot go on investigating, many of these questions are answered by looking at the patient actually, or by doing a diet log of what she's doing. If you have a dietary sort of an understanding of what she's been consuming for a period of 2 to 3 days, that's normally how we analyze a patient's eating habit and dietary habit. So simple thing that she can do is ask herself, is she really taking good balanced diet? And I always ask patients to score it on a score of 10.
Yeah.
Out of 10, how much mark they can give to themselves. So they will themselves analyze. It's important in our dhaka-dhaki life that we say stressful lifestyle. It's important that we identify, are we really able to meet those recommended dietary allowances? There are RDAs for every age group.
Correct.
Rajeshri, you are always been talking about it. And if we are meeting those, because your caloric needs keep on changing with every decade of your life, and are you physically expending them? Are you under stress? Because stress as a cook, which they'll say, no, I'm very happy, I have no problems. But the moment the bite doesn't come for work, then immediately they'll change, or somebody saying anything, they lose their, sort of cool. So even those spurts of anger, irritation, that can also give rise to release of catecholamines, which can affect your metabolism. So you must have understood that it is a conglomerate of three things in Marathi, which we typically called as, you can translate it, Rajeshri, you have a very good proficiency on English. I want three proper words for this in English.
Okay.
Ahar, Vihar, and Vichar.
Yeah. But you know what? I would be very, very honest that there are no English words as good as these words sound. So I mean, I will take my English back. So but yeah, of course, we keep talking about nutrition, personalized nutrition, positive thinking, counseling. All of these approaches are there, but yet that can't beat ahar, vihar, and vichar. It's such a rhyming one that you should make that as a slogan. I honestly think eradicate PCOS with ahar, vihar,
and vichar.
Yeah. and yeah, that's what it is. And traditionally also, I want to mention here that traditionally also this has been followed. And why are we seeing upsurge in the PCOS today, which we didn't see earlier? So somewhere those
currently, Rajeshri, I'm reading about the evolutionary change. Probably the nature is trying to protect women against unwanted pregnancies and complications. So it is saying, don't become pregnant.
Yeah. Well, I think the earth doesn't need any load anyways. But having said that, no, I think having said that, I think we have a big onus on ourselves to bring up better offsprings and
create a future healthy society. It's our responsibility.
Yeah. So and I think Corona times have taught us too much out of it. And in fact, I think from a nutritional standpoint, or also from a PCOS standpoint, I think this is a good time to educate, because a lot of people are receptive, they have time, and of course this is positive time to cook yourself, not get stressed that there's no maid there, but because you've got a chance to now cook yourself. And I think a lot of people who are not used to cooking on their own have gotten into that mode, and they should never come out of it.
Rajeshri, see, many of my patients, because they've started practicing very healthy eating and lifestyles, have started regularly menstruating, have lost weight, have conceived. Can you believe?
Super. Yes.
So this has a reason. This has a purpose.
Yes. So and I mean, we keep comparing since the unlock has started off, and you just step out and you will realize that the lockdown was better in terms of the stresses that we were off. So I think using these methodologies, keep inculcating this in your habit and attitude. I think that's the most important thing. We have few more questions. I have a question which says, and this is a very interesting one. I mean, someone anonymously shared it with me, and this is what I think we need from this program. If people want, we can actually even do more closed group sessions where people can anonymously send us questions, and we can address those, because another issue is the stigma and the feeling that can I ask this question is always there with women. And I think this platform is also created for the fact that you should feel free, feel empowered, that you can always reach us, ask us any question, even if it's silly or even if it's grave, which you're not able to address. So there's a question which says, I have PCOS and hence I am facing marital issues and hence more stress.
Yes.
So this is a question probably for a counselor, but what is the normal guidance do you give your patients?
Yeah, basically, see, in the PCOS, the reason why she's having, stress is compounding everything. And because of the hormonal abnormalities and the metabolic abnormalities, definitely have even the sexual responses or sexuality would change. There's a change and alteration in libido. Sometimes they would have a very heightened libido, and sometimes they would be just simply apathetic. Because as I explained in my talk, there are hormonal abnormalities, and this has to be understood, and it has to be falling in tandem with the partner's needs. So basically, when you are having any kind of such symptomatology or a syndrome, it is important that finally in any successful sexual kind of a relationship, both the partners falling in tandem with each other is extremely important. It's a teamwork. There has to be an understanding. And maybe there could be reasons such as, sometimes women are a little more conscious about their body structure. And if that is a reason, maybe because of the excessive hair or obesity, they may be having problems. So these can be taken care of with some proper temporary kind of a measures. And there has to be a long-term plan to be able to elevate yourself and come out of these issues. So this is perfectly common thing many times, as you said, Rajeshri, and we must thank this particular viewer of ours for coming up with this question, because this is a question which requires to be answered and to be dealt with, which they are always scared. And even in a private consultation, many times women would not be able to say this, spell this out many a times. For the simple reason that many of our Indian couples are also not aware of what is actually a normal sexual response, or what is actual normal sexuality. Because that information also is important, and the doctor can be the right person to guide you with that.
So also, I mean, I want to share something which we just discussed 2-3 days back on a parenting session, and one of the counselors out there actually suggested that we should utilize this time to sort of talk to our girls, especially, and also boys, in terms of puberty, what exactly it is and how it should be. And I think the onus first is like we said, reflecting on us. So we, as parents, we should first have the onus that we ourselves understand what it is about and how it should be, and explain it well to our younger teens and tweens also, if you want. So with that, I think we also have a question which says, my daughter had PCOS. Now the sonography, I mean, of course, the patient, what means is the sonography is now good. So she means the sonography is now negative. But can you hear me, ma'am?
Yeah, now I can hear you. Can you repeat the question again?
Yeah. So she says, my daughter had PCOS. Now the sonography is good, yet her periods are not normal. So can that be a scenario? Yes, that can be. Okay, looks like we've lost ma'am. Yeah, she's back. Yeah. Well, should I repeat the question again?
She doesn't have a regular cycle. She has PCOS.
She says our daughter had PCOS. Now the sonography is good. They don't see any cysts out there, but yet her periods are not normal.
I can't hear you. I'm sorry.
Yet her periods are, her periods are not normal, despite the fact, that the PCOS, she had PCOS. Now the sonography is good. So her consultant says that she's good, but yet her periods are abnormal. They're irregular periods. They're not normal.
If the periods still over HPO axis, we have to understand that even the ovary structurally we may look normal on sonography, but that is just a structural identification. She has a functional problem, and that functional problem requires a constant hand holding and cannot say that PCOS got treated. It never gets treated. The potential is there. Rajeshri, all of us have a potential of developing PCOS, hypothyroidism, diabetes, and all these diseases.
Yeah.
What is important is we have to modify this potential. And therefore, she has to be constantly, it has to be a constant adaptation of her lifestyle change. So
Yeah.
till then the time that you get regular cycles, your PCOS is still a problem underlying. It is probably, tip of the iceberg is the polycystic ovary, and below that surface is lot of things which require to be looked at.
So we also have, madam, there are some viewers also saying, we have Rajesh Chopra, you're saying it's a great topic. Patients should be educated and counseled, and counseling should be done vigorously. You're doing a great job. Keep it up, is what is the comment. I have Dr. Meena Prabhu saying that it's a great going, is what she is saying. Also, she herself is a gynecologist, a senior one really. And then these are a few encouraging comments we're getting from our viewers. Then I think we have Anjali Curry. She's also saying that Dr. Girija, precise lecture, nice to hear from you. There's one question now which says, how hormonal balance can be managed? Do you give steroids? Interesting.
See, the hormonal balance depends on what are your, sort of goals of management, and how much the hormones deranged. So depending on the hormonal derangements, we do not go by the cosmetics or the cosmesis of the patient always. It depends on what are the chemical findings that we find through the laboratory and what is actually seen through clinical assessment. Now, usually it is always a practice to search some hormones. The combination hormones which are given are typically in a little woman who is a little older. So, a very young teenager, we will not immediately jump to hormones. These will be given to women who are more than 19, 20 years of age, and these are hormones which are typically given at a level which is a little supra threshold than your baseline levels, so that these are the same hormones which are produced by your body. And all these contexts taken into account, whether it's going to cause you any harm, whether it's going to be really useful or not. And these combinations, taking that into account, are given to you. Sometimes in a younger child, we will just be using a withdrawal hormone by a simple friendly progesterone formulation, which is given periodically, so that she has proper cycles which are coming. But most of the stress is given on certain support treatment like diet modification, exercise, and sometimes in our Indian context, we are using a lot of myo-inositol. In your diet, you mentioned about myo-inositol.
Yes.
And Rajeshri, I also said that we can have a special session only on treatment of PCOS.
Yes.
We talk about all these things. So myo-inositols are very commonly and increasingly used in our practice in India, because insulin resistance is very typical of the Asian ethnicity. And therefore, that requires attention. And therefore, you will find that most of us are prescribing a lot of myo-inositol. If the insulin resistance is very high or the patient is pre-diabetic, then we would give them some metformin, which is an insulin sensitizer. So that is also given in a peculiar dose. If the woman has a lot of water retention, then certain diuretics with anti-androgenic properties are planned. And of course, a lot of stress is also given on certain micronutrient supplementations. Having said all this, whenever a doctor is putting a patient on maybe a cyclical pill or all these therapies are given as hand holding mechanisms. Because by the time these medicines are working on you, maybe for a period of 6 months or maybe for a period of 1 year or 1 or 2 years, you these medicines have. We want to be all these medicines, life lessons, and that you don't end up with any harm, as we saw cardiovascular disorders, diabetes, cancer. Then ovaries getting further injured by unovulated follicles. All these we need to avoid, and therefore these medicines are not given completely as a treatment, but they are as a supportive therapy to help you establish your lifestyle. And I think it does not take more than 3 to 6 months to adopt a healthy lifestyle if we really are determined and decide to do so. I think that answers the question adequately.
The there is I will actually just a couple of questions more, and one of the last ones here is that again pertinent to the treatment is is there sort of a permanent solution and treatment available with the newer researches coming up? uh, I'm sure you will
Yeah,
give a apt answer to this.
there are few newer researches coming up which are telling us that there are certain genetic predisposing factors. There are certain genetic labs which are even offering specific identification of genetic profile. So there are particular genes which are responsible for various things like leptin hormone, you are well aware of potentially, this abnormality would be there. Then how are you going to be able to modify the various kinds of nutritional methods? See, I always believe in Gandhiji's dictum, and that is, if you want to have an ideal world, you have to change. You cannot have things changing for you. What is happening to you? You will have to make that change. Change to be.
Okay, so
I think I just missed our trilogy, the ahar, vihar, and the vichar.
yeah.
Is the change that you will have to make.
Yep, absolutely. So I think with that we didn't even realize that we are almost 1 hour and 30 minutes, so approximately over 75 minutes that we are with our session today. But we will try to wrap up this session, and of course we will be coming up chronologically with sessions which will make a lot of positive change for the viewers listening, and of course then they can approach us if they need specialized treatment with our center if needed. But meanwhile, I would want ma'am to for you to sort of close the session with a few pointers, and then I can close the session with the viewers.
Yeah. Most important thing is that, first of all, thank you for this platform. Second most important thing is thank you for all the audience for logging in with us and being here. Thirdly, I hope that we are recording this so that we can keep it as a reference to our other following sessions, because Rajeshri, we are not going to stop at this. We are going to have a series of such sessions coming up on a regular basis. And we would fix it to Wednesday so that we have a, sort of a continuum. And then we'll be making referral to many times about these sessions. We will decide not to be repetitive and we'll be a little more focused. So that we are able to help our viewers, because while I'm sitting in my consulting, I always find that I want to talk more, but there is less time. And this is the opportunity that.
Absolutely. Absolutely. You said it. And I think from the nutrition side, what I also plan to do is explain the ingredients more to people and explain the interactive ingredients, the balance, but not make it repetitive. So with your sessions, actually I could pick up one ingredient every time and give deeper insights to the patients, so that they are not just googling information and they get the real understanding of things. And like you said, it will be W for women and W for Wednesday. So you always remember that it's going to be, the Wednesday is going to be with women health. We will keep this as a mission going forward. If at all we call it ahar, vihar, vichar, but in integration, of course, with the treatment that you are providing to your patients very actively, and the way we work hand in glove with it. Yeah, of course, as we discussed, it has the hereditary progression that we have to keep in strict understanding. Inflammation, oxidative stress, and what we eat today is not really, is it really what we should be eating, and is it healthy enough, and the lifestyle changes. So these were the things we really discussed today, and a personalized integrative treatment approach with nutrition and lifestyle modification with consistency. I think that's the most important thing, to not only improve our health but also improve the health of the offsprings to come. We
We
will
must
roll.
ask our viewers to give us
Yes.
some self-check mechanisms. They should give
Yes.
us some self-check points.
Yes.
And that would help. We
So
can create some such things.
you're absolutely right. So we will request our viewers to come up with any suggestions, any inputs, or on the questions that ma'am has put forward today, and send us all that in so that we can actually make this a more interactive, discussion-oriented session. Maybe it means we are just going to meet with 50 people, talking to them, and the 50 can then be 50,000. I mean, that's where I think, ma'am, we have started and we shouldn't stop. It's a mission in hand. When you say that, eradicating PCOS cannot be just a program, but of course a mission with you. So on that note, I think we will conclude the session. I thank the viewers as always for being here. Tomorrow we have a very interesting session on music therapy in neurological diseases. Wow. And how we have a neurologist, a very senior neurologist from Mumbai, who will actually talk about the science behind it. And then we have someone who's actually practicing it and has shown changes in patients where stroke patients have revived. And we will be sharing some of those insights. So looking forward to seeing you tomorrow again. Thank you very much, ma'am. It's always good to have you in the programs and to be able to see you. A pleasure being with you. Bye-bye, everyone, and stay safe.
Stay healthy, stay safe.